Hi, I'm Dr. Aaron Carroll, and welcome back to Healthcare Triage. We're going to be doing this show every week now, so make sure you subscribe right down there. In the first episode, we talked a lot about Obamacare and how people without insurance were going to try to start getting it. But that led to a lot of questions about insurance in general.
Yeah, exactly. When am I going to stop having to pay for my insurance?
You're still going to have to pay for your insurance. Obamacare is about access.
Now, Aaron, this was supposed to be a big government giveaway to friends of Obama. I am friends with Obama. I don't understand what went wrong.
Nothing went wrong. Let's start this week with the basics of health insurance. How does it work? How much is it going to cost? We're going to answer that and more in this episode of Healthcare Triage. Comprehensive health insurance isn't as old as you think. The first real plans appeared in the US around the time of the Civil War, and really those were just types of accident insurance in case you got injured while traveling on a train or a steamboat. This wasn't nothing, since trains and steamboats exploded pretty regularly in those days, but it didn't do much to help with what we would all consider routine healthcare. Well into the 20th century, there just wasn't that much need for health insurance. After all, what would you do with it? There wasn't much healthcare to buy. If you got sick, it wasn't like there was an MRI scanner or artificial heart that you were gonna get. You went to the doctor for leeches and laudanum, but if you got really sick, well, you sort of died. But as doctors and hospitals learned how to do more than amputate legs and shake their heads wistfully, they realized there was real money in this gig. So in 1929, a bunch of them joined up and formed an insurance plan called Blue Cross to help people buy their services. Doctors didn't like the idea of hospitals being in charge, so they created their own plan in 1939, which they called Blue Shield. So you had your Blue Cross for hospital services and your Blue Shield for physician services until they merged to form Blue Cross and Blue Shield in 1982. For the most part, people bought health insurance on their own if they wanted it. Some jobs offered it, but employer-sponsored insurance wasn't really a thing until World War II. Wartime emergency plans put wage controls in place, and so by law, companies couldn't compete for workers by paying them more. With so many men fighting overseas, employees were relatively scarce. So employers started competing for workers by offering them benefits like health insurance. Those weren't restricted by wage controls, and soon lots of jobs were paying for more and more comprehensive coverage. After World War II, President Harry Truman proposed scrapping this system for one of universal public health insurance. People loved this idea, but doctors, hospitals, and many businesses hated it. They'd already invested quite a bit in the current system. Labor unions also realized that they had a lot to gain by keeping insurance tied to jobs. They'd fought hard to get benefits for their members, and changing to a national insurance system would have made these gains moot. Truman lost. Employer-based health insurance won. Over the next 20 years, private insurance increased in popularity, but remained mostly unavailable to the elderly, the poor, and the unemployed. No one wanted to cover seniors, because they get sick a lot and cost a ton of money. But this meant that more and more people were faced with the difficult decision of going broke or letting their parents die. This was intolerable to many Americans, because all of them expected to be old one day, and they had no interest being stuck in this dilemma. After years of fighting, President Johnson signed Medicare and Medicaid into law to cover the elderly and the poor. And today, government programs cover about 1/3 of Americans. The rest of the insured are covered by private insurance. But why do we even need insurance? To put it simply, healthcare is very, very expensive. My oldest son had to go to the emergency department about a month ago. He received just an ultrasound and a doctor read it. Turns out he was fine, and he just needed an antibiotic. The cost of that visit, $6,000. And that's cheap compared to really big things like a hospital stay. Last year we spent something like $2.7 trillion on healthcare. That's upwards of 18% of our GDP. Most people don't have the kind of money to pay for care if they get sick. That's where insurance comes in. Everyone individually pays less, but sick people get the money. We pool risk, and the money goes to whoever needs it. By the way, anyone that complains that they don't like paying for someone else's healthcare is completely missing the point. Insurance is always about paying for someone else's healthcare. It transfers money from the healthy to the sick. How does insurance work? Well, the first thing you do is pick a plan. Plans differ on the amount of actuarial value they have. That's a fancy term for describing the approximate percentage of the cost of care that insurance will cover. If a plan has 60% actuarial value, then it covers 60% of the cost, and you cover 40%. Plans with higher actuarial value cost more. You pay more up front and pay less later. In the insurance exchanges, which we talked about in our last video, Bronze plans have a 60% actuarial value, silver plans are 70%, and gold plans are 80%. Insurance also has networks of physicians. These are doctors or hospitals with whom the companies have negotiated lower rates. You get better coverage if you stay in network and pay more if you go out of network. So if there are certain doctors you really want to see, you need to make sure they're part of your plan. The money you pay up front is called a premium. That's often charged monthly. That's what you see when you find out how much a plan costs. But that is not all the spending you'll do. Pretty much every plan comes with a deductible. This is an amount of money that you're responsible for paying even after the premiums before insurance coverage kicks in. The reason plans use this is that they think correctly that you're less likely to spend your money than their money. It prevents you from going out and getting a ton of care that you might not need. More expensive plans, which have more upfront money, usually have lower deductibles. Less expensive plans have higher deductibles. Not all care is subject to the deductible. For instance, most preventive care is fully paid for by your insurance right away. Even after you spend the deductible, you're not done. Most plans come with co-pays. These are set fees that you have to pay each time you access the healthcare system. They may be $20 for a doctor's visit or $100 for an emergency department visit. And it gets better. There's also co-insurance. It's the amount that you yourself have to pay for care above what your insurance pays. And then you have to give them a firstborn child, 2 wishes, and an ounce of ground unicorn horn. Just kidding, it's actually only 1 wish. Okay, I'm kidding about the whole thing. It's just the co-insurance is real. It's not all bad. Plans now come with an annual out-of-pocket maximum. For a family, it's at most $12,700, and for an individual, it's $6,350. So after you've paid that amount in deductibles, co-pays, and co-insurance, you're done. It's all on the insurance after that. Even better, there are no longer any annual or lifetime limits. Your insurance can never run out. So if you bought a silver plan, say with an actuarial value of 70%, for yourself from the exchange in Indiana, the premium might be around $4,000 a year, or just over $350 a month. Let's say it has a $1,500 deductible, $20 in co-pays for doctor visits, and 15% co-insurance. When the year starts, even with the insurance, you'd be paying for almost everything, until you spent the $1,500. Then you'd be paying $20 for each visit plus 15% of other charges until you hit $6,350. In a bad year, you could be on the hook for a total of about 10 grand, or the cost of the premium plus the maximum out-of-pocket expenses. This is going to come as a shock to people who assumed that health insurance would now be cheap or even free. But you have to look at what might have happened without it. What if it had been you who had to go to the emergency department a month ago? Instead of costing you $6,000, under this plan you would have been responsible for a $350 copay and a $900 co-insurance payment. That $1,250 is much less than $6,000. And this could happen a couple times a year. Or you could get really sick. Or you could have a kid. The average price for having a baby in the United States is $30,000. If you have a cesarean section, it's $50,000. People with insurance are way, way, way better off than those without it. So do your research. Figure out what you're willing to pay up front in premiums, but don't forget that networks, deductibles, co-pays, and co-insurance matter too. Figure out if you'd rather pay more up front or gamble that you won't need to and pay more later. But make an informed decision. Now you know. And knowing is half the battle. I always wanted to say that. Go Joe!
We all have a life map, a map that landmarks a set of goals that we wish to achieve in our lifetime. Goals as simple as getting a well-paid job, to owning a house, buying your dream car, and finally, a chilled-out retirement plan. But what do we need most importantly to achieve it? What? Did you say money? Well, there you are wrong. Money is secondary. Primary is your health. Health problems can cut short this wonderful plan of yours at any point. The day your health falters, so does your life plan. That's why we bring to you Bajaj Allianz Healthcare Supreme, a unique plan designed to take care of all your medical expenses. Today, a medical emergency can shoot up your expenses to any level. Hence, an insurance plan that provides cover up to 50 lakhs. With the benefit of 100% reinstatement of the sum insured. There are also many unique advantages like air ambulance and maternity cover, including newborn baby expenses. It also covers physiotherapy expenses, organ donor expenses, Ayurvedic or homeopathic treatment expenses, and not to forget, free annual health checkups regardless of the claim history. And it doesn't end here. There is more in store. Cumulative bonus of 10% on the sum insured for each claim-free year. Income tax benefit under Section 80D of the IT Act. 15 days free look-in period. Inpatient hospitalization expenses. Pre- and post-hospitalization expenses. Unlimited daycare procedures. Outpatient expenses. Recovery benefit post-hospitalization. So, what are you waiting for? Be prepared and zoom past your goals without any speed breakers in your dream car. Ensure your beautiful life plans with Healthcare Supreme right now. Bajaj Allianz. Relationship beyond insurance.